Dr. Mudit Khanna, Consultant Orthopedic Joint Replacement Surgeon at the South Mumbai unit of Wockhardt Hospitals. Today, we will be talking about osteoarthritis of the hip, essentially what osteoarthritis of the hip means and what total hip replacement surgery essentially entails about. So talking about osteoarthritis of the hip, let us look at this model which will help us understand how a hip joint really looks like. So a hip joint is a ball and socket joint where the ball of the hip moves around in the socket of the pelvis. The socket of the pelvis is known as the acetabulum. Now, wherever two bones in the body join and move, the surfaces of these bones are covered by a thin layer of cushion known as cartilage. So, in a hip joint, there is a layer of cartilage on the top of the ball, which is shown in the blue here. There is also a layer of cartilage in the socket, shown in blue on the socket here. Now, as arthritis typically means that you lose the cushion that covers the top of these bones to the extent that the bone starts rubbing with the bone. So now looking at another model which shows a relatively advanced stage of arthritis, what we see here is that the smooth cushion is denuded and the underlying bone is exposed, and now this bone grinds against the bone in the socket. The bone of the ball is now grinding against the bone of the socket, which creates pain and difficulty in mobility or difficulty in the range of movement of the hip joint. Now, when somebody has advanced stage of arthritis where there is bone on bone arthritis, what they typically need is a hip replacement surgery. So let's go on to talk about what a hip replacement surgery really means. So in a hip replacement surgery, this natural ball which is already damaged is removed and it is replaced by an artificial ball, and the socket is also refreshed and replaced by an artificial socket, creating a new ball and socket joint which is smooth, where there is no bone grinding against bone, there is no pain. Patients receive excellent outcome, are able to take the hip through their entire range of motion without experiencing pain and regain back their normal mobility.